Hello friends, welcome to our channel AB Homeo Club. In this video, we are going to discuss about the drug picture of Argentum metallicum, which is an important drug in Materia medica for all exams. So, the first we see here the Argentum metallicum. It is a metal. We all know that the common name of Argentum metallicum is silver metal. It is nothing but silver. Okay. Now, in the picture we here see the first point is that there is great emaciation is seen in Argentum med. See, great emaciation. So here the emaciation is indicated. There is gradual. There is it is not a sudden emaciation. It is a gradual emaciation is seen in Argentum med. Okay. Next, there is characteristic desire for fresh air. Okay, these people desire for fresh air, and the most characteristic symptom is the sensation of expansion. There will be sensation as of expansion in many organs. Okay, next, it is characteristically most commonly affects the left sided. The pains are mostly seen in left side. Okay, next here we see the sphere of action. The sphere of action of Argentum metallicum is especially the larynx, cartilages, bones, articulations and ligaments. So Argentum metallicum mainly acts on larynx, cartilages, bones, articulations and ligaments. Next we go here the mental symptoms of the Argentum med. Okay, if these mental symptoms of Argentum metallicum, there will be hurried feeling. They are always hurried. That's why they feel that time passes too slowly. Okay, so for those people who are hurried always, they always feel the time is passing very slowly. Okay, next we here see the melancholy. They are very melancholic always. Okay, next here we see that the head complaints. The head complaints we see there will be left sided paroxysmal neuralgic pains. Okay, neuralgic pains are seen mostly on the left side of the head. Okay, next there will be scalp is very tender to touch. The scalp is very tender to touch. Next, here the vertigo on looking at running water. While looking at running water also, these Argentum med people get vertigo. Okay, next the most important is the head feels empty and hollow. We should always remember the vertigo on looking at running water and head feels empty and hollow. Next, we go to the throat complaints. In throat complaints we see that there is rawness and soreness is seen in throat, and there will be the at the bifurcation of trachea. See here at the bifurcation of the trachea, this point, they feel rawness and soreness. Here they feel rawness and soreness. Okay, rawness is seen at the bifurcation of the trachea. It's nothing but here see rawness at the bifurcation of trachea and or near suprasternal fossa. See, okay, this is important in Argentum metallicum. Rawness at the bifurcation of trachea or near suprasternal fossa. Okay, next here we see in throat complaints there is raw feeling and soreness. They must hem and hawk while reading aloud. Next, expectoration from throat is there will be profuse and easy expectoration is seen. Now we see respiratory system. In respiratory system there will be hoarseness is seen, and there is also aphonia is also seen. So this is most characteristic symptoms of the Argentum metallicum, hoarseness and aphonia. There will be total loss of voice in professional singers. The larynx also feels raw, sore and raw feeling. Next, expectoration looks like boiled starch. There will be rawness at the bifurcation of trachea or near the suprasternal fossa. Next, the modalities of the rawness and soreness and the throat complaints and respiratory complaints. Aggravation on using, aggravation on reading aloud, and aggravation on the left side. Okay. Next, here we see the cough from laughing, and cough from laughing. On laughing they get cough. Okay. Next, there will be alteration in timbre of voice. Alteration in timbre of voice. It means something note alteration in the notes of the voice. Okay. Next, we see what have we seen till now. We saw this time passes slowly. Here, see like this snail. The time is passing like a snail. Like time passing slowly. That is the one thing, and especially Argentum metallicum mainly acts on larynx. Okay, mainly acts on larynx. This point. Here in sphere of action we saw that it acts on cartilages. Mainly the larynx is mostly made up of cartilages, right? Now we have seen that also emaciation is also seen here in Argentum metallicum, and now we are going to next part. The back, there will be back pain, severe backache is seen. So due to that backache, they must walk bent. They always walk bent due to backache. Okay. Next, in urine complaints, we see here there is profuse turbid urination, and there will be polyuria, diuresis, and very frequent urination is seen. And the urine is sweet in odor. The urine smells sweet. Okay. So what we have seen in urine, in urine it is profuse and turbid, polyuria, diuresis, and there will be frequent urination. Next, this sweet odor is present in the urine. Next, the extremities. We see extremities. Here we see extremities. In extremities we see there will be rheumatic affections of joints. There will be a joint pains, rheumatism of joints. Okay. Next, it is most commonly seen in the elbow and knee. There will be legs will be, extremities will be weak, and there will be trembling is also seen in the legs or extremities. Next, it also has the important symptom like a writer's cramp. So if anyone knows these details of the writer's cramp, then please comment down in the section. Next, there will be swelling is seen in the ankles. In rheumatic affections we commonly see the swelling in the joints. Okay. Now we are going to next. Here we see male complaints. There will be crush in testicles. In males and females we see, in males the most important organ is testicles. Now in females there will be ovaries. So here there will be crushed pain in testis. There will be crushed pain in testis, and in ovaries feels too large. Okay. In male complaints there will be crushed pain in testicles and seminal emissions without sexual excitement. Without any sexual excitement, there will be emissions will be occur. Okay. Next, in females ovaries feel large. While ovaries feel large, there will be bearing down sensation. Okay. So most commonly these bearing down sensation, bearing down pains mostly seen during climactic hemorrhage. Next, here we see the cervix. The cervix also eroded and spongy cervix. In leukorrhea we see foul odor leukorrhea discharge from the female genital tract. Next, and also this leucorrhea is excoriating. Here we see eroding and excoriating are somewhat similar, and these explains this eroded and excoriating. Okay, next we see modalities of the Argentum metallicum. The aggravation from touch and from and towards known. The complaints are aggravated towards known, and there will be aggravation from touch. Okay. Next, there is also amelioration by open air and the amelioration of cough at night when lying down. Okay. Next, so what have we seen in Argentum metallicum? Mostly we saw loss of voice, especially in professional singers. So loss of voice, especially in professional singers, and there will be crushed pain in testicles, and there will be ovaries. These ovaries feels large and bearing down sensation will be there, and there will be sensation of a raw spot on the at the bifurcation of trachea. Okay. Next we see the time passes too slowly. Okay, time passes too slowly. Next, it mainly acts on larynx, cartilages of larynx. There will be hoarseness and loss of voice. Okay, the rawness and soreness is also present, and again we see the gradual emaciation is seen in Argentum metallicum. So friends, this is the brief explanation on the Argentum metallicum. So in this video we have seen dark picture of Argentum metallicum. The source is from Boeck's Materia medica. So friends, if you feel this video is helpful to you, please like the video, and please comment down in the comment section, and please subscribe to our channel, and please share this video to your friends. Thank you so much for watching.